Hello and welcome to the 2018-2019 Pharmacare Employee Benefits webinar. During the next 15 or 20 minutes, we're going to be going through this presentation. And if there are any follow-up questions, please reach out to HR at Pharmacare at Aranya, or you can also reach out to our office with any insurance-specific questions to Linda Normando, who is in our Catto&Catto benefits office in San Antonio, Texas. We are a consulting and brokerage outfit that helps Pharmacare find and price the best employee benefit plans so that the organization can deliver them to you. My name is Ben Hallback, and this is the presentation that you'll see on your screen that we're going to go over today. So let's jump right in. On page 1, you'll see a listing of all the various benefit offerings from medical down to a health savings account, short-term disability, and long-term disability. We'll be walking through those coverages. In the middle part of the section, you'll see the criteria for when you can make changes during the middle of the year. As a general rule, what you pick sticks for a year unless you have one of these qualifying life events: marriage, divorce, birth, or adoption of a child. On page 2, there are some specific examples of qualifying event scenarios, just to make sure that you understand when you can change your election. But as a general rule, what you pick sticks for a year. Where we'll spend the most time today is on the Blue Cross Blue Shield of Texas employer plan. There are 2 plans. They're both on the Blue Choice network. One is a less expensive HSA high deductible health plan. That's the one on the left. The one on the right is more expensive, and it is a copay plan. It is called a preferred provider option, and you've got copays when you go to the doctor and copays when you get a prescription. So we're going to walk through some of the benefits here. What I want you to see is that the reason why the HSA plan is less expensive is because it has a little higher deductible, and it also has a little higher out-of-pocket maximum. The copay plan is more expensive really for the following 2 reasons that I already mentioned. When you go to the doctor, you're just paying this copay. When you get a prescription, you're paying these copays. Whereas on the high deductible health plan, when you get a prescription, you don't have any copays. You have the discounted cost of the drug. When you go to the doctor, you don't have copays. You have the discounted cost of the doctor's office visit. So the price tag when you use it is going to be a little higher on the HSA plan, whereas the price tag on the buy-up plan is higher in terms of the cost of insurance. It costs more, as you'll see here. But it costs more because when you utilize the benefits themselves, they're less of a price tag when you actually do use them. Now, one feature that's on both plans that we just love is this virtual visit option. Whether you're on the high deductible health plan or the copay plan, it's a $45 copay. So that's pretty cool. Virtual visit is 24/7, 365 access to a doctor. I've got 3 kiddos, and one of my kids clearly had pink eye. And so instead of going into the doctor's office and probably getting sicker, we called a virtual doc. They prescribed medication over the phone to the closest pharmacy to our house. Took us maybe 20 minutes. It's a really slick deal. As we've already referenced, here are the price tags. These are your cost per paycheck for the base plan or that high deductible health plan, or the buy-up plan, which has copays before you meet the deductible. But as you can see, on an all-in basis, worst case scenario, the numbers are pretty close. So worst case scenario, an individual on the copay plan for covered and approved services is going to spend no more than $6,000 on an annual basis. On an all-in basis, a member under the copay plan on an individual basis is going to spend no more than $5,600. So how you make a choice of these 2 plans is essentially the utilization that you would expect underneath that number. If you have high prescription drug costs, if you go to the doctor very regularly, you may choose to pay more in terms of the premium that you see here for the right to pay a copay when you actually use the plan. Or if you're relatively healthy, you like the idea of the separate bank account, the HSA bank account that we'll talk about in a little bit, you may choose to pay less in terms of your cost of insurance, but then when you go to the doctor, you pay the discounted rate, but it's not going to be a copay. And so the biggest element that I just referenced on an HSA plan is the bank account. It's with any high deductible health plan, you have an HSA bank account. This is a separate bank account that Pharmacare, because of their generosity, puts in $600 a year into your bank account, your HSA bank account, for your usage. This is your money. It doesn't go anywhere. It has no use it or lose it provision like the flexible spending account does. In the HSA, if you leave employment with Pharmacare, that money goes with you. These are the amounts that you can choose to payroll deduct above and beyond what Pharmacare puts in, which I would highly recommend. I have an HSA for my family, and I choose to put in more than my employer does, because if I don't use that money, then the account balance builds up over time as I contribute more money to it, and I can use it for anything medical, dental, or vision related. This Section 125 cafeteria plan just means the premiums go in before taxes, which is a good thing. And really, when we talk about these different options that are attached to the medical plan, the HSA plan, the money goes in not taxed, the money comes out not taxed. The flexible spending account is only for those who are on the copay plan. So you can't do a flexible spending account and a health savings account at the same time. So if you're on the copay plan and you have planned medical expenses, you have a vehicle that you can drive called a flexible spending account where you can pre-tax money into your flexible spending account. The biggest caveat to that FSA is this item right here. If you don't use the money, you lose it. That's set by the IRS, not by us or by Pharmacare. So if you're on the copay plan and you know you have some expenses coming down the pike, then I may suggest looking into the flexible spending account, because you're going to be able to pre-tax those expenses by contributing to the FSA. And you'll basically make an election at the beginning of the year. Say you wanted to put in $10 a month. Well, if you put in $10 a month, that's $120 for the year. All of that $120 would be available to you on day one, but you hadn't paid for it yet. So you pay for it over time. So there's some benefit in pre-tax payroll deducting into an FSA, but just remember, if you do not use those funds, you lose them. Aranya, or our office, will have a lot more detail if you're interested in driving that vehicle, so to speak. Because of your type of employment, y'all are really going to know this even more so than we would. It's where to go when. The doctor's office and retail health clinics are the least expensive. Those urgent care providers are the second least expensive. And then you've got your freestanding ER and the hospital ER. Now, no matter which city you are in the country, freestanding emergency rooms are popping up all over the place. I had a friend who was pregnant at the time. She was dehydrated, and she went to a freestanding ER thinking that she was going to an urgent care provider. They gave her some saline. That was it. Walked out with a $4,000 bill. So make sure that if you think you're going to an urgent care provider, it actually is. Watch for the signs. If it says you can see a doctor in 1 minute, it's a freestanding emergency room. Okay, let's talk about your teeth. It's written through Blue Cross Blue Shield. You will get an ID card in the mail. And the plan works like this. Let's say you're like me and you go in for your preventative teeth cleanings that I'm highlighting right here once every 6 months, twice a year. And then let's say they find a cavity. That says 20% after deductible. Let's say the price tag on that cavity is $200. Here's how the math works. $200 bill minus your $50 individual deductible equals $150 left on that bill. You're paying 20% after you've met your deductible, which you just did. So you're paying 20% of 150, which is what, 30 bucks? You're paying 30 bucks for that basic service. And 80% of that remaining $150 bill, which is $120, that $120 posts against the $2,000 annual max. So any money that they spend towards care posts against that annual max. It's per person, so if you've got kiddos in the plan, they have a $2,000 annual max. And no, for any parent who has kiddos that are looking at braces, $2,000 doesn't cover the cost of braces. So think of that as something's better than nothing in the insurance policy. I've got 2 of my 3 kiddos at home that when I go, they're smiling at me most of the time, and I'm looking at them thinking how much braces are going to cost. So if you can get some out of the insurance policy, then good on you, but it's not going to cover the total cost. The rates are here at the bottom. They're relatively inexpensive. This is a pretty darn good plan, and so we like continuing to offer it. Let's talk about vision. Prices are here at the bottom. Again, rates are pretty inexpensive, excuse me, for vision. ID cards are electronic only, which can confuse some people. When you go into the eye doctor, the thing that is the most confusing to people is this benefit frequency. Once every, once every, once every. Here's what that means. You can't get glasses and contacts in the same benefit year. You got to pick one or the other. So if you want some lenses, you'll be on a copay. If you want some contacts, they'll give you $130. If you want those lenses with some glasses, you get $130 for frames. Now, I will say, when you go into the eye doctor, this copay, those are for the fortunate people whose vision is a lot better than mine. So 2 things happened to me in 5th grade. Number 1, my basketball career peaked. Number 2, my vision started to go downhill, and it's been steadily declining ever since. So I have to wear cool guy glasses that are real thick just so they cover the thickness of the lenses. I have to employ an astronaut to shrink the size of the lenses down just to fit on my face. I'm not getting out for a $10 copay because I choose to do a lot more to those lenses so that they look way cool. Now, my wife has much better vision than I do. She could probably get out for a $10 copay because she didn't have to do a bunch of other stuff to those lenses. And so I just want you to be aware of that fact. Basic life AD&D. God forbid you pass away early. And you need the money to go somewhere. Dearborn National covers basic life in the amount of $10,000, maximum benefit up to $50,000 or 1 times your salary. Now, this is free to you, paid for by your employer. This is a great benefit. What you want to do now is make sure that your beneficiary information is correct. So the football has to go somewhere, so to speak, if you're not holding it anymore. You'll be able to do that through the online portal, but that's the biggest deal. Make sure your beneficiary information is correct. Now, what all this information on voluntary life means is if you want more life insurance than the free stuff that your employer buys on your behalf, then you can order some. You can apply for some. If you're a new employee, you get a higher amount that is no medical questions asked. That's what $150,000 of guaranteed issue means for the employee. If this is your first time and you're a new employee, then you get a no medical questions asked $150,000 that you can payroll deduct for. If this is not your first time, then you would be required to fill out evidence of insurability, which isn't a huge deal. I sat through this presentation several times. I only had 1 kid when I started, and now I have 3. I felt like I wanted more life insurance. And so when I applied for it, I had to fill out an evidence of insurability, and they sent a doctor to do a blood draw. It wasn't a really big deal, but you just have to fill out some paperwork, so I don't think it's automatic. And that's pretty typical. Here's how you calculate your cost. You say, okay, if I want $100,000 more, then you put $100,000 in the benefit amount. And if you were between 40 and 44, then you'd put 0.065 in here divided by 1,000, and then the number that spits out is what's going to come out of your paycheck. Okay, Disability insurance. When you hear the term disability insurance, I want you to think about insurance on your paycheck. For most of us, the ability to work and earn income is pretty important to our family. So if God forbid you were catastrophically disabled and could not come back to work, then you'd have a pretty hard time earning a paycheck. So disability insurance is insurance on your paycheck. You've got two different vehicles that reflect two different time periods, a short-term disability product and a long-term disability product. Short-term, 60% of pre-disability weekly earnings, up to $1,500 per week, or up to 11 weeks. Folks who are not pregnant now, but may be pregnant at some point in the future, that is a covered disability. So when my wife got pregnant for the second time, I said, congrats on being disabled. And she just furrowed her brow and looked at me and said, not cute, dude. So we do see a lot of females that are interested in this type of product if they are thinking about getting pregnant. Okay, long-term disability. Here's one of the best things about this plan. Pharmacare pays for it. This is your sleep at night factor. It protects up to $5,000 a month and goes to retirement if you are catastrophically disabled and can't come back to work. This is your sleep at night factor. If you can come back to work, then there's some offsetting that you'd be working on with the insurance company. Like if you could do your job or if you could do somebody else's job. But in general, where we see this policy have the most effect is if somebody had a catastrophic disability and couldn't come back to work and earn income, then their paycheck is protected up to Social Security normal retirement age. You do not want to have to pay for this type of policy. It's not cheap, and it's extremely generous that it's being offered. So the short-term disability is your call. You get to pay for that if you want it. Long-term disability is protected by Pharmacare paying for it on your behalf. You calculate costs on the STD in the exact same way that you would for the voluntary life insurance. Take your weekly salary, STD rate up here, 60% of the benefit divided by 10, and that's your cost of paycheck. So that way you can see what you are up for coming out of your paycheck. A couple other things, and we're almost done. The EAP, rarely used, but it's there for you. It's free, paid for by Pharmacare, included in Dearborn National, which is the Blue Cross Blue Shield products. And you get up to 3 face-to-face visits. So think counseling, referral services, finances, or family-related problems. So just think up to 3 face-to-face visits covered underneath your EAP. You just got to remember that it's there. Travel assist is kind of interesting that it's included in an insurance policy, but it is. And so if you're traveling more than 100 miles away from home, and think of this as most helpful when you lose your baggage or are having trouble getting home, or there's a passport issue. That's really where you zero in on this being effective for you. But again, just like anything else, you got to remember that it's there in the first place. Premium only plan, I think I spoke to that earlier. That is the ability to take the cost of the benefits out before taxes. That's a good thing, but that's what this plan is. The rest of the information in this packet are required notices. And so we're not going to go over those today, but please review them as reading material if they are important to you. So we're required to let you know all of these things, but we're not going to cover them in the webinar today. So here's some Q&A on page 20 that I would suggest you review before you sign up for anything. So the HR team at Pharmacare did a great job about putting together these. And so it'll probably help steer you in the right direction, we think. So some Q&A. Just to be able to take a look at who to call when there's a question, and then some contact information for HR and for us. Now you'll go online to this website, pharmacare.employeenavigator.com, preceded by that HTTPS, and you'll plug in a temporary username and password, and then a permanent one will be generated, and it'll walk you through making your choices. And so it'll be a little bit like a Amazon shopping experience if you wanted, employee-only coverage on medical and family coverage on dental, that it'll automatically tally up the price tags for those, and you'll be able to see that very, very clearly. Glossary of terms, just to define all of the insurance information. You can also reach out to us or Aranya to be able to further translate that. That will conclude our presentation today with these very happy people on the back of the guide. Thank you for your time and for your attention. And on behalf of the team at Pharmacare, thanks for joining us today. Bye-bye.